joining me, we have Dr. Fleming, and he is from OrthoCarolina. Thank you so much for being with us today.
Thank you. Appreciate it. Thanks for having us.
Absolutely. Now, talk with us a little bit about OrthoCarolina for any of our viewers who are not familiar with it.
Well, we've been in Boone for 40 plus years. Dr. Bill Herring started the practice back in 1971, and Dr. Ted Waller joined him, and then Dr. Kate Ike, and I came in 1986. So I've been here going on 28 years. We were Boone Orthopedics, and we joined OrthoCarolina, which is a larger group in Charlotte, about 2 years ago. And so we've been here a pretty good little while, taking care of folks in the high country.
Fantastic. Well, you must be very good at what you do to have been around for so long.
Well, I appreciate it. I hope so. Thank you.
So what kind of led to that move to join OrthoCarolina?
Well, medicine's getting a lot more complicated these days, particularly keeping up with the government programs and electronic medical records and what's called meaningful use. In a 4 or 5 man group, it's just really difficult to keep up with all of that. And then insurance contracts and bottom line, it just gets more complicated, and you want to take care of patients. You don't want to do the business all the time, at least I don't. And so we got some help. That's the main reason we did it.
Very neat.
Yeah.
Now, what are some of the main changes that you've seen going from Boone Orthopedics to OrthoCarolina?
Oh, well, that's an interesting question. We do have the help. For instance, the folks in Charlotte are the ones that do our insurance coverage. They're the ones that do the workman's compensation paperwork.
Right.
We had to get their electronic medical records, so we had to convert to their computer program. And as probably most people know, that's what medical practices now are doing. You have to have electronic medical records. So that was one of the biggest things. We actually switched to digital x-rays, which is kind of neat. Instead of having an x-ray film, you look at your x-rays on computer and you can make them bigger and smaller, and it's kind of neat.
Very neat.
So.
Now talk with us a little bit about orthopedics and what all that includes.
Okay, well, orthopedics is the treatment of bones and joints.
Okay.
We treat sports injuries, we treat, specifically do hands, we treat foot and ankle, we do total joint replacements, basically anything that involves injuries to the bones and the joints, and arthritis, and all the medical conditions that affect the joints.
So a lot of training and schooling that goes
Fair
into
amount.
this field.
Takes a little time. Takes a little time.
Now, why did you decide to go into this field?
Well, I was going to do family practice actually, and I liked surgery, but I didn't really like general surgery. But I'm kind of mechanical, and I like to fix stuff, and that's what orthopedics is. I mean, basically, you're fixing broken bones and making people better. You treat all ages. You treat children to adults and older folks that break their hips, etc. So it's fun to see all the age groups and different people, and I just really enjoy it. I mean, something I like to do.
Very neat.
Yeah.
Now, is there something that you most commonly see?
Well, me in particular, I see carpal tunnel syndrome probably the most. It's a very common condition. Being a hand surgeon, that's one of the most frequent things I treat. I mean, I see that every day.
And what causes that?
They like to blame repetitive type activity. Some of it is just, it's our anatomy. The carpal tunnel is in the hand, and that nerve gets squeezed or gets pressure on it over time, and it starts to become symptomatic. So that's something I see a lot.
And then how do you handle that? How do you treat that?
Well, you try to treat conservatively at first. You put splints on their hands. You decrease their activity. If they're doing a lot of texting or typing or something like that, you try to decrease that. Eventually, surgery is the definitive treatment if they continue to have symptoms. A cortisone injection will help for a period of time, but surgery will fix it. And so if we end up having to do that, that'll take care of it.
Now, do a lot of the cases that you see in general require surgery, or are there other things and other steps that you can take?
Well, there's definitely other steps. Certainly some breaks need to be treated surgically, and some people get to the point where their joints are worn out. And so a joint replacement is going to help them a lot, get them back to what they want to do and to their normal function. But we certainly treat things, shoulder bursitis and trigger fingers and just arthritic joints and sprains conservatively. Splint them and put them in a cast and rest them and try to treat them, with their medications and stuff.
Right. Now, joint replacement sounds like a very tedious thing? Tell us a little bit about that.
The main two joints that we replace are the hips and the knees, and that's the two joints that become, arthritic fairly frequently. One of my partners, or several of my partners, are the ones that do most of the joint replacements here. And they work very well. I mean, when people get to the point where they hurt and they can't get around and their joints are getting stiff, the joint replacements a lot of times can make them pain-free and certainly restore that function. It is a big surgery, and it does certainly take something to get through it, but it's a very rewarding surgery. It relieves their pain, gets them back on their feet.
Now, as far as athletic injuries go, we have a lot of student athletes here in the high country. Any common things you see there?
Well, there are a lot of athletes and a lot of activities in Boone, from skiing to mountain biking to football, basketball, all the sports. You see it in all ages. You certainly see broken bones. The ski season keeps us busy. Sometimes too busy, but we enjoy taking care of them. We take care of all the high schools actually in the area, and we've been taking care of the college athletes, Lees McRae and ASU athletes, for 40+ years. So we enjoy that. Two of my partners in particular are board certified in sports medicine. They have a subspecialty, and that's a lot of what orthopedics is.
Very neat. And so the sports medicine side of that, how detailed is that and how important is that differentiation?
A lot of general orthopedics is sports medicine. I mean, you take care of ankle sprains and knee sprains, and athletes, of course, break their wrists and their hands and ankles and stuff.
Right.
So orthopedics involves sports medicine to a large degree. There is a subspecialty called sports medicine, which really works with mainly the athletes at the football and the basketball and the skiing and so forth. But to be honest, it's all orthopedics, and we enjoy doing that.
Awesome. Well, I actually went skiing for the very first time here recently, and I can understand how a lot of injuries might come from that. I was not very good.
Sometimes the icy conditions up here and the crowded conditions up here. We see a lot of folks that come up the mountain and it is their first time, and
Yes.
they get injured their first time, so that definitely happens.
Absolutely. Now, do you guys deal with emergency situations, or is it by appointment? How does that work?
We definitely deal with emergencies, and we're on call to the emergency room all the time, and we actually cover Ash Memorial Hospital as well as Watauga and Cannon Hospital over in Avery County.
Okay.
But we certainly take care of if they call us and they need follow-up in a week, we take care of that. A lot of the emergency room physicians will splint a fracture or splint an ankle sprain, and we'll see it a week later. And if you pull a muscle, or you injure yourself slipping or falling or tripping when you're playing basketball, we see you after you come to the office.
Now, where are you guys located?
We're right across the street from the hospital on Doctor's Drive.
Okay.
And we see people, as soon as they call, as far as same day or certainly the next day. Different ones of us do different specialties. We try to cover all the aspects of orthopedics, from hand to foot and ankle to sports medicine to total joints. So we have the largest diversity of the practices here in Boone.
Very neat. It sounds like you guys are a great asset to the community.
Well, I like to think so. I hope so. I appreciate it. We actually have a new spine surgeon, too, that has come within the past year, and he's been a great asset. I think he's going to do very well.
Fantastic.
Thank you.
Now, what is your personal history? How did you end up here in Boone at OrthoCarolina?
Well, I grew up in eastern North Carolina, and I went to Chapel Hill, and I went to med school at Wake Forest. And actually, my first summer in med school, I came up here and spent a summer with Dr. Devant in Blowing Rock. And it was actually both Dr. Devants, the older Dr. Devant and Bunky. And I really liked the high country. I liked Boone. It seemed like a great place to raise a family. My wife is from Western Virginia, so she grew up in the mountains as well. And
right.
When we decided to look for a place to practice, we looked, and Boone had the university, had Appalachian State, it had a shopping center and a mall, and the schools are excellent. I mean, my kids did very well in school and have actually both gone to medical school. So it was a very nice place to raise kids and then grow up. And we like the outdoors. We like hiking, and I like to walk my dogs. And I'm a little bit of a runner. I'm getting older, but we enjoy a lot of the things you can do in the high country.
Most definitely.
Appreciate it.
Well, it's been a pleasure to have you on the show today. Thank you so
Thank
much
you.
for coming on to talk with us.
Well, I'm glad you had us. Thank you. Appreciate it.
Absolutely. And we will be back right after these messages with more of the Mountain Television Network.